Good evening, everyone, and welcome to MUHA's online public interview series. For those who've joined for the first time, thanks so much for tuning in. I think we can all agree that the world which we live in today has changed dramatically over the past few months. So in such circumstances, we see new questions and new challenges being raised every single day. To respond to such times, we turn to the experts. This interview series will bring in a number of different academics from various disciplines and have a conversation about their unique perspective on the times that we face. For today's interview, we're joined by Dr. Pratt, so thanks so much for giving us your time today.
Yeah, no worries.
So could we just get a brief introduction about what you do?
Sure. So I am an ethics researcher at the Melbourne School of Population and Global Health at the University of Melbourne. And so I primarily look at the ethics of global health research. So the ethics around doing health research primarily in low and middle income countries in Asia and Africa. And so a lot of the questions I look at are around, how do you meaningfully engage communities in setting research agendas, which largely in global health research have primarily been the domain of researchers and funders from high-income countries for a really long time. And I look at other questions just around, how should funders be structuring funding programs in ways that can actually help reduce health disparities? How do researchers go around doing studies in ways that help reduce health disparities in terms of the research populations they work with, the research questions they ask, and also what kind of capacity development and knowledge translation they do as part of their studies. So those are some of the questions that I look at.
Great. So for today, we'll be talking specifically about bioethics. So could you give us a brief introduction into that field specifically, in contrast to ethics?
Yeah, so ethics looks at questions around good conduct. So questions like what's the right thing to do in this situation. And it also looks at questions around human flourishing and the good life. Essentially, what is the good life and how do we structure society and relationships in ways to achieve that? What do we prioritize and who? And I think those questions in terms of coming up with a strategy for both containing the COVID-19 disease and also in the strategy for how to start easing back some of the restrictions, ethics comes hugely into play.
Yeah, absolutely.
So bioethics is focused, it's within ethics, but it's focused on the ethics of living beings. And there are, depending on who you ask, but traditionally people would say that there are at least 4 different subdomains of bioethics, and they're all really relevant to the current pandemic context. So you've got clinical ethics, which is the ethics around the doctor-patient relationship. And so, for example, in the current pandemic context, doctors might be asking questions, we've only got so many ventilators. Which patients do we actually give them to out of all the ones who need them? So, in New York City, I think that's been a huge issue doctors have been facing. A second sub-area of bioethics is research ethics. So that's the ethics of the researcher, participant, and also the funder as well, relationship. And so questions in the current pandemic context there are, should we be doing challenge studies, which are essentially trials where people purposefully get exposed to COVID to see if vaccine and treatment candidates actually work, despite the fact that there isn't actually any effective treatment for the disease. And another question that is also being talked about is, should any intellectual property rights on an effective vaccine be essentially given up? Because the primary importance is, getting the vaccine available and accessible to everybody worldwide, not, making money off of it.
Yeah.
A third dimension of bioethics that's also incredibly relevant is public health ethics. So that's looking at the ethics of protecting and promoting health at the population level. And so that's the subdomain that comes into play when, Australia is thinking about, do we go down the herd immunity route or do we go down the lockdown route? And it also comes into play when you're trying to think about, health is important, but so is the economy. How much of a trade-off are we willing to make in terms of the economy in order to protect people's health? And lastly, there is global health ethics, which is thinking primarily around the ethics of protecting and promoting the health of populations outside your country. And this is typically focused on populations that are considered to be marginalized or disadvantaged. And the questions here that come into play are around, what is Australia and other high-income countries' responsibility to help countries in Africa and Asia and the Pacific who may be less equipped than we are to deal with the pandemic.
So throughout all these different subdomains, and we'll look at both Australia's response and the global health response a little bit later in the interview. But all of these subdomains are still, they still follow some general themes about trying to find what's the right thing to do. So I was just wondering, how do we actually reach the ethical conclusions of what is right to do? Do we consult history or philosophy, or have discussions with other people in the field?
Yeah, I mean, you definitely have discussions. You definitely reflect. You're definitely critical. I guess two things that are common across all of these domains of bioethics are features of what I would call ethical analysis. So the first step is really just identifying what the ethical issue is or what the ethical concern is. And so that's really about, identifying where somebody is in moral distress, where they actually they don't know what the right answer is. Or it could be about identifying ethical concerns, which are essentially events or actions or behaviors that, aren't consistent with important values and principles. And so they're considered, potentially morally wrong by doing them. So it's essentially identifying those issues and concerns. And then the next step is actually systematically clarifying, prioritizing, and justifying amongst different courses of action on how you would address them. And you do that by applying ethical concepts and principles, and also in the context of scientific evidence. So it's really about applying moral reasons and concepts to practical problems to kind of identify how you fairly balance interests, how you prioritize amongst different courses of action, and then also how you identify, who's ethically responsible for implementing these different actions. And a big part is ethical concepts and principles there, but also in the face of, contextual information, because ethics is very contextual, and taking differing situations, different country contexts, is a very important part of applying ethical principles and concepts.
Absolutely. And so one area which you would apply these ethical principles is health policy. So I was just wondering if you could explain briefly, how are these ethical concepts and health policies intertwined? How do they interact with each other?
I mean, do you mean practically in the?
Practically, yeah.
I mean, it varies. It's kind of interesting that you bring that up, because I think one of your questions had been around the ethical basis for the government's response, and criticism coming out of the ethics community in the UK, but I think it holds here, is just, I guess, it's unclear to what extent the government has actually been informed by an ethical and social perspective.
Whoa.
They definitely have been relying on experts in science, and epidemiology and other areas of public health, but I don't know to what extent they have ethicists, people with formal ethics training, as part of their expert committees who are advising them. In the UK, the Nuffield Council on Bioethics they've issued a statement that calls out the UK government for not doing that, and for not actually involving the public in a lot of the policy making decisions.
That's quite surprising.
Yeah, but I think it's a really powerful statement. And actually, there's part of it that I think, I'm just going to read it out because I think it's important, and I do think it applies in Australia as well. But they essentially call for greater, and this is in relation to the government's developing a strategy for how we're easing back restrictions specifically, but they call for greater inclusion in terms of the strategy for easing current restrictions, in terms of decisions around, what gets prioritized and why, looking at who bears greater burdens and why that is, and why that's fair, and of what principles and values are informing the decisions about how to proceed. And so this means what they're calling for essentially for the government is to show the public what the government is doing and thinking across the range of issues and concerns, to set out the ethical considerations that informed its judgments, to explain how it's arrived at its decisions and not that it's just following science, and invite a broad range of perspectives into the room, including wider public representation, and to think ahead and to consult and engage other civic interests. So yeah, the sense I've gotten from the policy making here, and I'm not saying it's been a bad outcome. I think Australia is doing incredibly well relative to a lot of countries, in large part because the government has actually been listening to experts rather than going down the more political route, which I think is a large reason why the American effects of the disease are much more severe.
Yeah, absolutely.
But at the same time, when it comes to public health ethics principles of transparency, inclusion, and governance, the process here has not been as inclusive as it could be, both in terms of the diversity of the experts and also in terms of, I think, the lack of public involvement in a lot of the decision making.
Yeah, absolutely. So now I'd like to dive in a little bit deeper into Australia's policy response in particular. Yeah. So recently we've been pretty lucky that we can actually start to go outside now and interact with all of our friends and family. So yeah. with easing the restrictions, it has brought to light a couple of different ethical questions, I'm sure. But in terms of how we have responded to this epidemic, we have decided to go for a flattening the curve response. That's correct.
Yeah.
So, whereas other countries have gone for a more loose response, like herd immunity, where there are no such restrictions, where we can't really go outside, all that kind of stuff. So, what are some of the ethical implications of this decision between herd immunity and flattening the curve?
I mean, it definitely sends a message around what the government and potentially, I guess, the society value and prioritize. I mean, I think the herd immunity route, it's only explicitly been attempted by, I think, like 3 or 4 countries, although some might say that just the way that the US is keeping things loose is a little bit along those lines as well. But I think herd immunity ties a bit back to utilitarianism, which essentially says, that the most ethical course of action is the one that delivers the greatest good for the greatest number. And so that essentially emphasizes, prioritizing the economy and the wider community over the lives of the people who are most likely to die because of the pandemic. So the health interests of, the elderly and other populations that are vulnerable are outweighed by the interests of, the rest of the community who will suffer really adverse consequences from the economy being, forced into lockdown. And so I think those are some of the ethical underpinnings of the decision to go with herd immunity. And there are definitely, ageist and ableist undertones to that sort of approach in terms of saying like whose lives actually matter the most. It's the youth and able-bodied people who can work.
Okay. Yeah, I was just wondering if you could give a bit of an explanation on what exactly ableist is.
Just not prioritizing those who are living with disability, essentially.
Oh, okay.
Yeah, so able-bodied people.
Yeah, gotcha.
Yeah.
So in terms of flattening the curve, do you think that from an ethical point of view, do you think that was the right decision? So when you look back on the government's response in the past 2 months,
Yeah.
did you think that was a good outcome?
Yeah, no, I did. I mean, flattening the curve is essentially, trying to lose as few lives as possible. And then also to ensure, that the healthcare system isn't overwhelmed by a massive influx of patients. And that goes back to more of a, I guess, a solidarity or prioritarian approach. So in terms of having solidarity with those who are more vulnerable to actually dying from the disease and taking their interests at heart. And then also prioritarianism means, giving priority to those who are considered to be worst off. So by, saying that we want to lose as few lives as possible, the government has really been prioritizing lives over the economy, at least just in the short term, to ensure that as few people die as possible. So yeah, from an ethics, I mean, I guess I'm a bit biased because I primarily do look at social justice and equity. So anybody taking a prioritarian approach is consistent with a lot of the work that I do. So I'm a bit biased, but I mean, I do think the way that the government approached things was an ethical course of action, yeah.
So when you say prioritarian approach, does that take into account that like a lot of people who are stuck at home due to this flattening the curve response, and they have seen an increase in the incidence of like mental health issues?
Yeah.
Is that a worthy trade-off?
I think some of the issue there is, so the government recognizes the fact that, the lockdown is going to have massive economic implications, social implications for people. And they have tried to implement certain things to kind of mitigate those effects, which is consistent with another public health ethics principle, which is along the lines of, identifying kind of the harms and the burdens of implementing certain restrictive public health measures, and then taking action to mitigate them as much as possible. So, I mean, they've been implementing lots of kind of support packages, stimulus surplus, kind of the job seeker program. Unfortunately, there are definite gaps, and I think people are identifying what some of them are, but I mean, domestic violence has gone up. I'm not exactly sure how they're addressing that. And there are definitely people who fall through the cracks in the job seeker system. And I think I read an article about carers having a particularly hard financial time at the moment. So they've tried to mitigate the harms, but I think there are still inequalities and gaps in what they've done. And I mean, it's sort of up to them at this point to try and fix those things. And we'll see kind of, I guess, in the coming months if they do that.
Yeah, I suppose there will inevitably be some kind of trade-off, right? No matter what response you take.
Yeah.
So
yeah.
when the government is deciding on these health policies, how is it that they can weigh up the ethical considerations and economic considerations?
I think a lot of it is just doing a bit of an analysis, according to what the benefits and the burdens are of different ways forward in terms of a lot of different sectors. So, I mean, health and the economy are kind of two areas, and also people's, social well-being, just in terms of people's relationships, and then their personal, like, physical security. I mean, there are a number of different dimensions of well-being that I think it's important to analyze how different policy options affect all those different dimensions of well-being. And I mean, that's how an ethicist, you start with your concept of the good life and well-being. It has lots of different dimensions, and you're kind of looking at how different policy options affect those different dimensions, and kind of weighing up, which ones look like they're going to have the most adverse effects versus others. Can those adverse effects be mitigated in different scenarios so their impact isn't actually that bad? And then sort of figuring out which one looks like on the balance of benefits and burdens is the best way forward. I don't know if that's actually how the government has been doing its decision making. Again, I feel like that's been a bit of a black box to some extent.
Yeah, I mean, I guess they haven't been so transparent on the ways in which they are making these decisions, right?
Yeah, I mean, I'm glad they're following science, but at the same time, science isn't the only discipline that's pertinent to draw on, and experts aren't the only people whose opinion should be sought. I mean, I think there should be a lot more engagement with the public. I know it's an emergency kind of fast moving situation, but I mean, there are so many online platforms, like they're just ways of engaging the public that are still an option, even if we can't be face to face.
Yeah, absolutely. So you're saying that transparency is one of the most important ethical considerations. Like the public should be really aware of what is happening up in that in the government.
Yeah. So I mean, I can give you a short list of different public health ethics principles, and I don't think any one is more important than another, but they're just kind of different principles that you can kind of think about, well, in the COVID situation, in terms of the policy making response, have these principles been upheld? So I think two, which I have touched on and complained a bit about, are transparency and accountability. And then another is inclusion, which is really around that, public engagement in decision making. A third would be just around identifying different risks and burdens in terms of all the different dimensions of well-being. So not just, health and people's kind of poverty or incomes, but also impacts on like their relationships. Social isolation is really hard. And also people's personal security, just in terms of like domestic violence and other factors to consider. Certain people may be at greater risk of personal security issues in the lockdown, and then figuring out ways to mitigate those harms and burdens. And then a fourth principle that's really important is around justice and fairness, and ensuring that any health and other well-being disparities don't get widened by how the response to the pandemic is handled. And so that's really considering, how do a lot of the measures that we're implementing actually affect those who are already quite marginalized and disadvantaged. So, I mean, there are lots of populations there. I mean, it's, there are asylum seekers and refugees. There are, people living with disability, indigenous populations, the elderly. I mean, there are different populations to really think about how the response affects them. And then the last principle, which is the one that seems that the government is definitely kind of thinking about, is the principle of proportionality. So that's just around, not implementing, it's around implementing measures that are in proportion to the public health threat. And so you're essentially implementing measures following the science. So you're looking to implement measures that have substantial gains in terms of reducing disease transmission, and that will save lives. And then you're also making sure that they're the least restrictive ones available. So you're meant to be responding in a way that's proportional to the threat, but also in the least restrictive way. So if you could, achieve the same gains with a least restrictive measure on people's autonomy, then you should go with that option. And I think the government's response has been proportional and least restrictive so far.
Yeah, but it's really difficult, I'm guessing, to maximize all of these principles at the same time.
Yes, they do come into tension. You can't uphold all of them. Certain responses will definitely advance certain principles more than others. And there are definitely trade-offs. And that is when it's really important to have conversations where you talk to a lot of different people. Because I think it's just important to open up getting a lot of different perspectives on how the public would actually want things to go, like which principles and values do they prioritize, and taking that into consideration when the government is deciding ways.
Yeah. And when you say people, you mean like different kinds of populations with from all sorts of different walks of life.
Yeah.
Yep.
Yeah.
So now I'd actually like to transition into looking at the response from a more global scale.
Yeah.
So looking at China in particular, what do you think about China's response? Is it just to restrict the freedoms to limit the spread of coronavirus?
Yeah, it's an interesting conversation because I definitely, when things were unfolding, I was following the news and I was kind of looking to see like how restrictive things were in other countries, to kind of get a sense as to like how restrictive things could get here. And it was just interesting to see the variation in the types of measures that other countries were implementing, and how countries with, I guess, certain countries were very much locking things down a lot more than other countries. And China was clearly one where they were able to really lock things down in a way that I'm not quite sure we even did here. Yeah, I'm not, it's tricky because I think they've done things here in a way that's really flattened the curve, and it hasn't forced us to lock down quite as much as in China. So to some extent it does depend on the science, but I don't know if necessarily a country does have to be as restrictive as China was in order to achieve the health gains or the health situation where the curve's been flattened.
Yeah, because I guess there comes a point where if you add any more restrictions, you're not going to gain much more health benefits, right?
Yeah, and it's also a matter, and this will vary by country, for how long the population is willing to actually follow the restrictions. I think Australians have been pretty good in this respect. I think other countries, it's been harder to convince people, and the pushback has been greater. There have been protests in the US around a lot of the lockdown measures in certain states that have actually led to them easing restrictions well before they flatten the curve. So it varies by country as to how long the public is willing to accept lockdown restrictions.
And we can't pick a health policy, or we can't pick a policy from other countries that look successful and adopt it for ourselves. It's not that effective, is it?
You can, but it's again thinking about which policies out of others that have been used like actually fit the context here, and that you think could be adapted. Not all will, but I think you can learn a lot from other countries in terms of what policies have worked there and getting ideas for what you could try here. I definitely was looking to see what the lockdown measures were in other countries under the assumption, that a lot of similar things could be tried here.
Next question. Because I saw a pretty interesting thing in one of our previous interviews, where the person that we were interviewing, he mentioned how France was limiting export or placing restrictions on export of things like respirators, all that kind of health equipment. What do you think about that?
It's interesting that you say that, because I made comments, I think, in something else I did on this, around the fact that countries were essentially figuring out what the worst case scenario was and then stockpiling things to kind of make sure that they had enough for that. But then in the Australian context, we've averted the worst case scenario. So now we have stockpiles. What are our responsibilities? Do we hoard them and keep them? Or do we kind of look around and see that there are other countries that are doing a lot worse and think, well, maybe we shouldn't hoard them. Maybe we should allocate them out to countries that need them. And before this interview, I was actually doing some Googling because I was trying to figure out what Australia has been doing to aid other countries recently, because I've been following the news, but sometimes it's good to take a pause. because just a bit dire at the moment. But yeah, it was actually really hard to find what we were doing for countries, even within the Asia Pacific. I think I found some articles from like a month ago that said we'd been donating some test kits, and I think maybe there'd been a few statements that, you know, we're not going to reduce the kind of piddling aid budget that we already give them, but that seemed to be the extent of it. So I feel like I'm being very critical of the government here. The situation is quite good in this country.
So do we have like a responsibility as a country who is quite well off in terms of how we've responded to the situation? Do we have a responsibility to help out other countries that are not doing so well?
Yeah, I mean, we definitely do. It's hard now because our economy is not doing that well, but I think part of the issue is that there are a lot of other countries that they're going to be hit by this, and it's not just going to affect their health. So, I mean, we can offer assistance in terms of health, but then these countries are also not likely to be able to do things like we're doing here, which is, you know, coming up with these support packages for people. Like their economies just aren't equipped to be able to do that. So they're going to need not only health support, but also economic support. And I mean, it's a question of what can we do there, given the situation with the economy here not being as good as it once was. But I still think we have obligations to assist. I mean, because those countries are going to be worse off than we are, undoubtedly. And it's really around prioritizing those in greatest need rather than those with the greatest strategic reasons for helping them, which will be a slight detour from how I think aid often works. It's usually allocated out to countries that it's strategic to assist, which is why I think historically Australia is generally focused on countries in the Asia Pacific rather than helping out in Africa as much.
Is that just because it's more accessible to us?
It's partly because they're more accessible, but it's also a politically strategic thing that they're in our region, and it's for the good of Australia if there's security in those countries. More so, Africa has less of a direct effect on what happens here security-wise.
Yeah, absolutely. So we mentioned beforehand that we do have a stockpile of health equipment. So we've discussed that, if we do have a stockpile, do we have an obligation to give that to other countries who are maybe in more need health-wise than us?
Yeah.
But what if there was a prediction of like a second wave? Is it all right if we stockpile these in anticipation of a second wave?
I mean, I think you can, but I think it's probably not as much as what the worst case scenario was in the first wave. So I think there's a way of, you know, you don't give everything away, but I think there's probably a proportion that could be allocated without, you know, making things really difficult here if things do get worse.
Yep, absolutely. Yep.
And I guess the other side of things is that direct assistance, so, you know, providing healthcare and test kits and whatnot, it's only one aspect of kind of what I would call global health justice. And the other half is, you know, building capacity and ensuring, because a lot of countries, like their emergency care systems, like their health systems are not strong enough right now. So, I mean, there's also the dimension of building up health systems in other countries, which I think is something we haven't been doing so much with our aid budget in recent years, and is potentially something that could be addressed.
I think it's easy to forget that some countries don't actually have the healthcare capacity to deal with the situation like Australia does.
Yeah.
So That's all in terms of questions. I was wondering if there's anything I didn't ask that I should have, or anything you want to talk about.
No, I don't think so. I should probably do a disclaimer that even though I have been very critical of the government's response, I still think that they've been doing a good job. And yeah, I'm very happy to have been in lockdown here relative to a lot of other countries.
Yeah. Well, I think it is important to not be complacent in terms of analyzing our response and how we can do better in the future.
Yeah.
So
yeah.
I think
And
it's perfectly fine to be critical of the government's reactions.
Yes, they were intended to be constructive.
Well, anyways, that's all we have time for today. So I hope everyone watching has enjoyed and learned a little bit more about the field of bioethics. So thanks again to Dr. Pratt for joining us today. If you'd like to learn more about it, I think you can send Dr. Pratt an email. Is that right?
Yep, definitely. Very happy to answer emails and chat.
Perfect. Well, thank you very much for tuning in today, and I'll see you next time.